Hello, everyone. My name is Leigh Anderson, and I'm on the faculty of the Evans School of Public Policy and Governance at the University of Washington in Seattle. Welcome to this session on the Evidence Consortium from the Evidence Consortium on Women's Groups. Starting us off is Thomas DeHoop, the Program Area Lead for Gender and Social Protection at American Institutes for Research. He is currently the co-principal investigator for the Evidence Consortium on Women's Groups, a 4-year research project that focuses on synthesizing, strengthening, and disseminating research on the impact and cost effectiveness of large-scale government-supported women's groups in India, Nigeria, and Uganda. In addition, he is a principal investigator for a quasi-experimental study of a women's group program in Nigeria and a cluster randomized control trial to determine the impact of a technology-aided instruction program in Zambia. So, Thomas, I'm going to let you kick off the presentations.
Thanks very much, Leigh. I'm just going to share my screen. And we thought it would be useful before we start with the presentation to give you a brief introduction to where we're coming from. Today, we hope we can contribute lessons from evidence synthesis about women's groups. And that basically leaves us with a number of definitions. We're all members of the Evidence Consortium on Women's Groups, which Leigh introduced already. It's a global evidence consortium with a focus on India, Nigeria, and Uganda. And it focuses specifically on contributing to resolving evidence gaps in the area of women's groups. That leaves, of course, the question, like, what do we actually mean with women's groups? And it's a very broad term, actually. And like, I'm actually citing a study that we jointly did with the Evidence Consortium of Women's Groups, a portfolio evaluation of the Gates Foundation's investments in women's groups led by Leigh herself, actually. And it's basically an umbrella term commonly used to refer to different models of economic, health, and community groups with a primarily female membership. And I think there is one thing that stands out in this definition, if you think about it. And the one thing that really stands out here is the large variation. We can talk about economic groups, we can talk about health groups, we can talk about all kinds of other focus areas. And like, I'm just giving a few definitions here of different kinds of groups, and we will be speaking about different ones of those, each of them during this session as well, with self-help groups focusing on female participants physically coming together to collectively save funds in the name of the group to facilitate intra-group lending. I will not give you all the definitions right now. You can read them here on the slide. But today we're going to speak about a large variety of groups, and I think one key thing here is also that this variation is really important for their effectiveness. We cannot speak about necessarily the effectiveness of women's groups in general. We need to always take into consideration the specific implementation model that women's groups implement, and that has to do both with like the gender composition, the primary organizing purpose, as well as like the different kinds of activities that they implement. And I know that this is like a conference, and many of you have probably already been in sessions that cover lots of evidence synthesis and systematic reviews. But before I start this session, I also just wanted to briefly introduce like how we consider evidence synthesis, and it's really based on like I think by now quite a high-profile contribution on how to do systematic reviews in international development. And when we think about evidence synthesis today, we're going to have several of them: systematic reviews, scoping reviews, and I think there's a lot of gray in their definitions. And they're not always so easy to distinguish from each other, but in basically evidence synthesis, the way we understand it is they capture and consolidate information through a synthesis of all the existing high-quality evidence using transparent methods to give the best possible generalized statements about what is known. And one question I often get is like, what is like the key distinction between what a systematic review is and what a meta-analysis is? Today, we're actually not going to have discussions about meta-analysis necessarily, but we could do it based on some of the evidence we present. But I think the key definition is like, Systematic reviews really use a clear protocol for systematically searching defined databases. And you can read the rest of the definition on this slide. Well, meta-analysis is really a statistical method to pull information on study effect sizes and enables you to estimate both average effects across settings as well as the variation across settings. So I just wanted to start with these basic definitions before we actually start our presentations. So I'm going to actually then move to my other presentation immediately after that on specifically one of the topics and that we're going to discuss today. And one definition that I actually didn't give yet in my previous introductions, actually, this is becoming very meta, but basically what we did when it comes to adolescent girls and young women in low and middle income countries, and this is with Nicole Haberland, with Sarah Engbretsen, Sapna Desai, and with Wai Ngo, is what we really did is we did not only conduct a systematic review, no, we brought all the evidence synthesis on adolescent girls, and specifically adolescent girls groups. We brought them together, and we did a review of systematic reviews to bring all of this evidence together. So we had some basic objectives in this study. And specifically what we wanted to do is examine what interventions, especially but not only group-based interventions, show promise in economically empowering adolescent girls and young women in low and middle income countries. We were specifically interested in girls' economic empowerment. And for that reason, we specifically focused on economic components, but we also wanted to look at girls groups and other interventions focused on adolescent girls that offered combinations of economic components, life skills components, that focused on social and reproductive health, because many of these groups do more than one thing. And they have a combination of different components. And I'm coming back to that later. In addition to that, and we did not actually create evidence gap maps, but we did want to examine what are the gaps in the evidence base and how, in terms of how group models deliver outcomes. And this also has a very direct objective. Some of this also served to basically guide some of the investments of the Gates Foundation in adolescent girls groups research in the future potentially.
Thomas, I'm sorry for interrupting, but I wonder if I'm the only one who's seen your entire screen rather than just the slide.
It looks like there's two screens.
That's perfect. Okay, much better. Thank you.
Okay, thank you. So for this review of reviews, we had specific inclusion.
I think Thomas is muted.
I can hear you, Thomas. And you did have your correct screen up.
Okay, can you still see my screen?
Yeah, you just have to go back to the slideshow from the current slide, I think.
Okay.
Great.
Sorry, I was just checking whether I was still mute and I had to switch screens. So for this review of systematic reviews, we had specific inclusion criteria. We included reviews that included experimental as well as quasi-experimental studies. So not only RCTs, but also quasi-experimental studies that had a different kind of comparison group. Obviously, the reviews needed to include adolescent girls. And as already mentioned previously, they needed to include economic components because we had a specific focus on women's economic empowerment. We also looked at economic and empowerment outcomes. And specifically, we searched 6 databases. We did not do a full review of systematic reviews, like a very comprehensive one, because we had a strict deadline and we wanted to make sure that we could do this relatively rapidly. But we do believe that we came up with a relatively comprehensive overview of the evidence by looking at 3IE databases, Campbell collaboration databases, Cochrane databases, and also several of the authors of this review of reviews also knew of specific systematic reviews that were done because we were personally involved in them ourselves. So we predefined what we would consider as effective, as promising, as unknown as an evidence gap and what we would consider as ineffective specifically. And what these are relatively subjective assessments, but we thought it would be useful to predefine this to also set expectations from the beginning. So I will not give all of these, but like basically what we did is we said like an intervention is really considered effective is if a meta-analysis with 3 or more studies show beneficial effects of more than 0.20 standard deviations, or if more than one systematic review shows beneficial effects. We did not completely dismiss vote counting. So we also considered reviews that vote count that are based on 10 or more rigorous studies or at least 30 estimated effects as effective. And when I say vote counting, I basically mean those systematic reviews that rely fully on counting the number of studies that estimates statistically significant effects. We go down basically, and like more promising is like one systematic review demonstrating beneficial effects, more than one systematic review with promising effects of more than 0.10 standard deviations. And but in addition to that, like, and we will see that this is like there are quite a lot of evidence gaps, is that more research is needed when no systematic reviews of meta-analysis show positive effects, or systematic reviews primarily show inconclusive evidence. We also have an ineffective if a systematic review really shows major unintended consequences. In total, we included 17 reviews based on an initial search of 2,447 hits in database searches. And I'll just move to like some of the results because we have quite some of them, and because we only have limited time for this presentation. And like what we saw is that like in general, economic programs such as vocational training, business training programs, and on-the-job training, they actually were highly included. And vocational and business training, they show promise for increasing income, employment, and entrepreneurship. This was shown in various systematic reviews. Some of those focused exclusively on adolescent girls. Others had a broader focus, but they still had studies included in them that focused on girls up until like 29 years old. And one thing that we also saw is that there's only limited evidence on the effect of savings. We will see in some of the other reviews actually that savings was a major component of some of the other reviews. But adolescent girls groups and other interventions focused on adolescent girls often have a somewhat limited focus on savings, and possibly also for like important reasons, because savings may be more important for adult populations. But we also saw that when combining life skills, which is a really broad concept and often ill-defined in systematic reviews, different reviews mean different things with life skills. Some of them focus on sexual and reproductive health training, others focus more on social skills training. So it's a very broad concept. But what we did see is that like programs that did include life skills or gender transformative training, in addition to economic components, also saw like not only promising effects for economic outcomes, such as like employment and income, but also some health outcomes. And that's focused specifically on contraceptive use, for example. For girls groups in particular, because so far what we have done is we have grouped together interventions that focus both on girls groups and other interventions that focus on adolescent girls. Economic components were included in about half of the girls groups that we reviewed. And one thing that we really saw is like, though there were promising effects, just for some of the other interventions, what we could not do is disentangle the effects of economic components of girls groups. This was one of the objectives that we had, to really see like how important are the economic components of girls groups, but none of the systematic reviews was actually able to do so. And it's primarily because of the primary studies not actually estimating the effects necessarily of economic components relative to other components. They instead, what they do is they often focus on the effects of an entire package. Some of the systematic reviews actually try to address these evidence gaps. And like one systematic review, for example, they showed from Chin and al. That adding life skills or internships to vocational training did not actually increase effects on employment relative to programs that did not do so. But adding life skills to vocational training did increase effects on earnings. And adding cash transfers to business training did not actually increase effects on the sales or profits of small businesses. So there were mixed effects. And then there was another study conducted actually by Haberland et al. And they conducted 8 studies with a multi-component arm. So like studies that specifically aim to assess the effects of different components. And those programs with more components seem to perform better, but clearly more research is needed. So overall, we see that there's a lot of promise of some of these interventions to improve economic as well as sexual and reproductive health outcomes of adolescent girls, but there are also quite a few evidence gaps and limitations. Our findings at this moment are based on a relatively small number of reviews. And a large number of those reviews actually rely on vote counting, which has major limitations, as probably some of the other sessions during this conference also show, with each study being treated equally, meaning that the magnitude of the effect and the sample size are not considered, often also without risk of bias assessments, for example, of the individual studies. And this also showed like in the quality of the included reviews, which varied quite a bit. So like lots of work still needed, but also lots of promise in like having some of these adolescent girls interventions and also girls groups actually to see what their effect is on economic outcomes. Thank you so much.
Thank you, Thomas. And I think we'll go through the presentations in the interest of time and wait for questions at the end. So next up is a colleague of mine, Rebecca Walcott, who is a PhD student at the University of Washington with research interests in financial inclusion and the regulation of fintech innovations. Becca also has a background in health and evaluation. Becca?
Thanks, Leigh. I'm thinking you can see my screen. Is that correct? Okay, great. Hi, my name is Becca Walcott. I'm a PhD student at the University of Washington, and I'm presenting the findings from an evidence synthesis on women's groups and covariate shocks conducted with partners at EPAR, UW, AIR, and the Population Council. To begin, a couple of definitions. So we focused on covariate shocks, which are shocks that occur at the community or macro level and tend to affect multiple households simultaneously. Examples of these would be natural disasters, disease outbreaks, conflicts, or economic crises. And these are opposed to micro level shocks, such as like the death of a household wage earner or loss of property. Also, for resilience, we conceptualize resilience in our synthesis along these 3 types of capacities. So we have absorptive capacity, which is the ability to cope with or absorb a shock, such as if I'm a member of a savings group that has compulsory savings, then I have this accumulated savings with which to absorb some kind of income shock. Adaptive capacity, which refers to learning and making strategic adjustments to mitigate the effects of shocks. Maybe in my group, I've learned about disaster preparedness or crop diversification. I've learned strategies so that I can adapt to some kind of shock. And then finally, transformative capacity. And what we mean by this is just some kind of systemic adjustment to the status quo that reduces the vulnerabilities to future shocks. An example here would be women's groups who participate in some kind of collective advocacy for policies that might reduce their vulnerability to future shocks. We looked at 3 main research questions for this. The first one, how do covariate shocks affect women's groups? And within this question, we're thinking, we're trying to figure out, like, to what extent do shocks affect group resources and activities? Do women's groups do anything to adapt to shocks? And then are there any specific implementation features of a group that contribute to group resilience? Our second question, how do women's groups mitigate the effects of covariate shocks for members? To here, we're trying to figure out, like, to what extent does membership in the women's group increase the resilience of member households? And then finally, how do women's groups support community responses to shocks? And we're looking at these 3 questions with sort of the overarching question of how can we learn from past evidence in order to inform a response to COVID-19 and future shocks. The process for evidence synthesis. We began by constructing search strings from keyword components for women's groups and a variety of shocks. We incorporated both general and really highly specific search strings to return a really comprehensive search results. And then we cast a really wide net with our search process. So we deployed our search strings in academic databases of peer-reviewed articles, as well as targeted searches of organizational reports, news articles, blog posts, and additional gray literature. We reviewed the titles for relevance, and we took those relevant results and we screened them according to our 4 inclusion criteria listed here. And for all documents that met our inclusion criteria, we coded in a coding spreadsheet. And so we ended up reviewing over 2,800 search results and included 90 documents in our evidence synthesis. So this table gives an overview of our included literature. A couple of takeaways. The majority of our studies were set in Sub-Saharan Africa and South Asia. Most of the women's groups we looked at had some kind of economic focus. A lot of the shocks tended to be weather shocks, a lot of rainfall shocks. And then the majority of studies were qualitative with their methodology. So for our first research question of how do shocks affect women's groups, we found predominantly negative impacts on group activity, resources, and sustainability. Some shocks made it impossible for groups to meet, such as disease outbreaks with social distancing, floods or weather shocks that would wash out roads, conflict shocks that would displace members. For economic focus groups, the shocks tended to reduce members' ability to contribute to the group resources, while simultaneously increasing members' need to draw on group resources. And so this was a strain on group sustainability. When we were looking at how do group functions potentially change, we found some examples of shifts, such as during Ebola, when women's groups shifted their function towards spreading awareness and assisting with contact tracing. There are also some examples of women's groups joining in community responses and participating in early warning systems for disaster risk communication. For economic groups, we found that some groups would alter their group policies to deal with the shock. And so an example of this would be adopting more flexible policies around contributions and repayments. However, being more flexible with compulsory savings or loan repayments was a bolster to individual member resilience, but it was a challenge for group resilience because it meant that the group resources were not being sustained. And then with regard to group features that contribute to resilience, we found the most important factor was some kind of formal linkage to an organization or financial institution that was outside of the shock affected area. And these linkages, they provided some kind of like uninterrupted access to credit and other resources for the group members. For our second question of how do women's groups mitigate shocks, we found generally positive impacts for a variety of groups, shocks, and resilience indicators. Most of these indicators were consumption-based, such as food expenditures, but we did find a few studies that looked at other resilience indicators like child development outcomes, school enrollment, or some kind of reduced internalized stigma. Studies examining the impact of groups on member resilience were largely focused on economic-based groups facing a weather shock. And we only had 20 studies in our review that addressed this question with a research design that included a comparison group. So there is a lot of underexplored territory in the literature for this question. We found that a primary mechanism for absorptive capacity was access to group-based credit or some kind of compulsory savings. And then for groups that didn't have a credit component or for which credit was clearly depleted, access for information sharing networks really facilitated adaptive capacity. There were examples of information networks so group members could learn about labor opportunities outside of the shock affected area or crop diversification strategies. to help produce some adaptive capacity for members. Finally, we found some qualitative evidence that women's groups may not equitably support member resilience. Examples of this were sometimes the most vulnerable in a community would be systematically excluded from groups or kicked out of groups due to some stigma around poverty or biased assessments of members' ability to contribute. For our third research question of how do women's groups support community responses to shocks? So during covariate shock, women's groups have the potential to serve as like a pre-existing human infrastructure for information dissemination and intervention delivery. And we found examples of women's groups playing a role at all parts of community response in preparation, during response, during recovery, and transformation. Our review of studies also found that while women's groups have shown to be valuable partners, there's still a lot of room for progress in their inclusion and response. The final slide here is just a summary of conclusions and lessons learned, excuse me, that may be applicable to current and future covariate shocks. The first is just that sustainable access to resources is a crucial resilience mechanism. And we see this most clearly through the formal linkages to financial institutions and NGOs outside the shock affected area. The flexibility around contributions and repayment may increase member resilience at the cost of group resilience. And we haven't seen a whole lot of this tension between member resilience and group resilience explored. And so that would be an avenue for future research. For our second research question, it's likely that groups mitigate the effect of covariate shocks for members by increasing absorptive and adaptive capacity. And we say that with the caveat that the literature is concentrated in economic-based groups experiencing weather shocks. Meaningful partnerships with women's groups at all stages of disaster preparation and response have the potential to improve community response, and they also have the potential to increase the transformative capacity of women, involving women, especially in preparation. Measures can help reduce their vulnerability for covariate shocks. And then finally, policymakers who are concerned about equity should carefully examine interventions and adaptations because there is heightened potential for inequitable outcomes during shocks. And so that concludes my part of the presentation. So I think I pass it back to Leigh.
Thanks, Becca. And I'm sure there'll be a lot of literature coming out of this period of COVID. So there will be more to append. Next up, we have Doctors Tabitha Mulyampiti and Eve Naminsango. Tabitha is a senior lecturer in the Gender Studies Department at Makerere University in Uganda. She's a development researcher who focuses on women's movements, social change, and social transformation in sub-Saharan Africa. As a member of the Evidence Consortium on Women's Groups, Tabitha serves as a project director for work in Uganda, liaising with the Gates Foundation. She also works with BRAC on barriers and facilitators to women's leadership in savings associations, and the ILO on understanding and improving women's work on digital labor platforms. Eve, apologies that I do not have a bio for you, so can I ask you to briefly present your primary research focus and associations before you start your presentation?
Thank you. A research fellow at the Africa Center for Systematic Reviews and Knowledge Translation, Makerere University Economics. And my research focuses on gender and inclusion, then vulnerability and addressing issues of graduation in vulnerable households in fragile states. Thank you.
Thank you so much. So I will turn it over to both of you to lead us through the presentation.
Thank you very much. And we are going to speak to the scoping review of the evidence on women's groups in Uganda. And I acknowledge all the co-authors and institutions that contributed to this piece of evidence. I'll just set the stage and speak to the persistent barriers that we have in Uganda, where we have seen great progress towards gender equality, but the pace is not convincing, and lots of inequalities continue to exist. And it's no wonder that Uganda is ranked the 159th out of the 189 countries on Gender Inequality Index. Many of our girls start childbearing at the age of about 19, over 35% married by the age of 18. The access to contraceptives is very low. It stands at about 11%. Our maternal mortality ratio is very high at about 336 per 100,000 live births. And about just 27% of registered land is owned by women in Uganda. But we have lots of promising best practices so far. For example, 58% of Ugandan communities have 10% of adult women in Uganda have membership at least to a women's group. And the government of Uganda is supporting women's groups, and it's rolling out lots of development programs through this platform. And savings and other microfinance groups are the most prominent formal and informal types of women's groups. And we have a lot of support from development partners to fund women's groups as an intervention to support development. And this is just a brief snapshot on women composition in women's groups. And from the first bar, we can see that women constitute a significant or high proportion of membership in these groups. And women are participating so well in terms of leadership, but we can see that they are less likely to take on secretarial roles. So now I'll speak to the scoping review that informs the findings. So the purpose of this scoping review was to explore the evidence and evidence gaps on the impact, implementation, and cost effectiveness of women's groups in Uganda. And specifically, the review aimed to inform a theory of change to guide the formulation of a learning agenda that can identify research topics to address the evidence gaps established. And these characteristics such as eligibility criteria for entry into the groups, the size of the groups, and then the governance structures and a lot of other parameters. And secondly, we aim to establish the available evidence on implementation models for women's groups and the kind of interventions that are implemented through women's groups. And then third, we wanted to look at the impact of women's groups and interventions implemented through the women's groups. And because costs and cost effectiveness are important for resource allocation, we aim to look at the available evidence on costs and cost effectiveness of women's groups in Uganda. And it was also very important to look at the available evidence on pathways for change. And therefore look into the mechanisms that inform methods. We used a scoping review approach to map and summarize the evidence. And our search terms included groups.
If you're occasionally breaking up, I wonder whether the connection might be better if you put off your camera.
Groups, lending groups,
Eva, I think for some reason you can't hear Thomas, so I'll just repeat what he said, which was you're cutting in and out, and we're wondering if it might be smoother to hear your voice if you turn your camera off.
Nigina. Nigina is a very, very localized.
Eve, we're unable to hear you. Can you try turning your video off? Oh, I think we totally lost Eve. And Tabitha is telling us that her connection is not too good either. Thomas, are you familiar with this work? Would you like to finish up the presentation?
I can potentially do that. I would just have to bring up the presentation. But Tabitha, I don't know whether you could try first. But
So
let me
looks,
otherwise
yeah.
bring up the presentation. I don't have it in front of me right now.
Tabitha, are you able to bring up the, oh, interesting. Okay. Would you be able to bring up the presentation and just move the slides as Thomas goes through it, or are you finding that all forms of bandwidth are compromised? Ah, there's an idea. Ah.
I'm bringing up the presentation right now. I think we were here, still at the research question stage. Am I correct? Tabitha, is this something where you can jump in?
Can you guys hear me?
Yes, we can
I
hear you.
can't hear you people.
Yes, we can hear you, Tabitha.
You can hear me, yeah?
Yes.
Okay. Can I share the screen? Oh, it's already on.
Yes, I have the screen open for you, Tabitha.
The letters are extremely small. The letters are very, very tiny. I can't even read. Can I open mine at my computer?
That could work, yes.
So I'm wondering if it makes sense to, I want to make sure we leave Rupal sufficient time to present as well. Although it doesn't sound, Tabitha, like this is a problem that will resolve itself in a few minutes. It sounds like a more systematic bandwidth issue.
I'll switch on off my video and try just to use the audio and see if you guys can hear me, and then I'll carry on from where Eve left, if that is okay.
I wonder, Tabitha, I honestly don't know whether you can hear me, but I wonder whether it makes sense to have Rupal do her presentation first, so that you have time to prepare.
I've switched off my video. I hope you can hear me, and I will just continue from where Eve left. Hello?
I don't think you can hear us, Tabitha. Can you hear me?
Very faintly.
Okay.
I hear very, very faintly.
Great.
I don't know what is happening to my, pardon?
Can you move quickly through the slides, because we still have Rupal to present? So maybe move quite quickly. Is that okay?
Hello, if may I, Tabitha, are you facing any problem to share a presentation?
Yes, now I can't share. I failed to share it, and I just want to read through it very quickly.
Okay. Okay, thank you.
Yes, I failed to share it. And when Thomas shares it, I don't see. The letters are very small. And so I will talk about the evidence findings, the scoping findings, sorry. I'm sorry for all this is happening to the internet. I think it's a nationwide problem. It's raining so much these days, and we are not having a good connection. But all the same, we're trying to do the best we can. But I think it's up to the government to do much more. So Tabitha, Mulyampiti once again, and happy to be here. I'll go straight to what our scoping of evidence on women groups found. And our major finding was the evidence on the impact and interventions implemented through women's groups. We found that microfinance groups showed positive impacts on access to credit, savings, and other economic outcomes, such as acquisition of household items and livestock. It's also important that we share the finding that impact evaluations on livelihoods, particularly those groups of adolescent girls who were infected with HIV, had positive impacts when their routine health checks and attempts to enhance adherence to the ARV therapy, they were forced to save, they were encouraged to save, and participatory learning and life skills were as well introduced to the program, and the impact of this combination gave encouraging results. So we concluded that adolescent girls groups could easily have positive women empowerment outcomes. On cost effectiveness,
we cannot see your screen, by the way.
You cannot see my screen.
No, Tabitha, and we are at time, so I'm wondering, I think your recovery's been magnificent going to the findings. Can you just maybe wrap up the findings vocally, and then we won't worry about the the screen, but we can share with participants the slides later.
Great. Let me just wrap this up. Overall, the main gaps in the evidence were that there is still a very narrow evidence base in Uganda. The evidence is uneven and very limited, and also very inconsistent. Particularly, there is an outstanding gap on evidence on livelihood and health groups. There is evidence gaps in research on cost analysis. Actually, such research was very uncommon in Uganda. Evidence gaps on possibility of male capture in women groups. This is something that was raised, and yet there is no research because over 50% of the groups were mixed groups. There is also very limited evidence on critical consciousness of gender, and there is inconstant measurement of women's empowerment. And finally, all the evidence that exists was limited to a few non-governmental organization reports and students' dissertations. And so leaving the research base really on women groups very, very narrow. There is need for rigorous experimental and quasi-experimental studies on women groups. And we also need to gather more evidence using a multidisciplinary team cutting across economics, health, sociology, gender, and anthropology to get better, deeper understanding on women groups. And finally, we need to build evidence on girls' groups and their response around the COVID-19 effects, and tighten measurement on women's empowerment, on measuring women's empowerment. We need to tighten tools for measuring women's empowerment if we are to have a better understanding and a guided discussion on the level of the impact as well as cost effectiveness of women's groups. Thank you very much. It's been tough presenting the way we have, but all the same, thanks so much for giving us this opportunity. Thanks so much.
Thank you, Tabitha. Your voice came through very clearly, and I think the combination of your findings with Eve's setup on access to reproductive health and Thomas's coverage on adolescent groups make for some nice research streams to come out of these papers. So thank you. Our last speaker is Roopal Singh. She's a program officer at the Population Council India, a statistician by training with research interests in public health, women and child health, mental health, and HIV. Under the Evidence Consortium, she has been working on evidence synthesis on the effects of integrated economic and health programs with women's groups. Prior to being at the Population Council, Roopal worked at the Institute of Economic Growth in Delhi on studies in agricultural statistics under the Ministry of Agriculture. So Roopal, I will pass it over to you to wrap us up. You're on mute, Roopal. Still on mute. I'm hoping that at the organization level, no one's muted you. Let me see. Welcome back, Eve.
Thank you.
So Rupal, you were able to speak earlier. I'm not sure. Becca's saying she had to click the mute, unmute a couple times for it to work. Maybe try your video and go back to your, do your on-off video, then on-off mute. Now try the mute.
If may I? Hello. On Chrome. Okay, so the mute button is highlighting or not? Let me in chat.
हेलो हाँ भैया ठीक है मैं आता हूँ उसको देखता हूँ इसको दीवार लगा देगा
So again, I'm wondering, Thomas, if you have this presentation
Yes,
as
yes.
well.
1 minute.
Oh, wait, Rupal's rejoining. Eve and Tabitha, you are not alone. Yes,
Hello? Can you hear me?
we can. Wonderful.
Oh, goodness, thank God.
We
I'm so
can.
sorry. I just don't know why.
No worries, Rupal. I don't think it's your fault.
No, we're
It's just
all
a
at the
huge
mercy.
Jinx. All right, let me give it a shot to share my screen. I hope that goes without a hitch. Oh, goodness. Okay. Tell me when you see my screen.
We
See
see
me?
it. Yeah. If you just want to
Okay.
go to slideshow. Perfect.
Okay, so now I will begin. Hello, everyone. I am Roopal from Population Council, India, and I'll be presenting to you a systematic review that we're doing on integrated health and economic interventions with women's groups. We're doing with this systematic review under the ECWG in partnership with Stanford University and AIR. I'll just dive right in. To begin with, why did we need to do the systematic review? Increasingly, governments and implementers are using women's groups as a platform to integrate add-on interventions in addition to their original organizing purpose. For example, adding on health interventions to economic groups. Even though this concept of layering is becoming more and more prevalent, there has not been any systematic evidence review around the health effects of such integrated health and economic interventions. This is where we feel there is a research gap, and which is what we want to fill in with the systematic review. For this very purpose, the research questions that we are looking at through this systematic review is firstly to examine the effects on health of such combined economic and health interventions on outcomes of health, nutrition, or sanitation in lower and middle income countries. Secondly, in addition, we want to explore the factors that relate to the final outcomes and how do these final outcomes come about in terms of the content, the context, the setting, the implementation processes, and each of their enablers and barriers. In the systematic review terminology, we begin with this PICO setting, which is firstly the beneficiaries of these interventions are adults or children. The interventions that we are focusing on in the impact evaluations must be group-based, women's group-based. They must have an economic and a health outcome. Each of the impact evaluations must have a comparator or a control group, which may have either one of the interventions, the health or economic interventions, or may have no intervention at all. The outcomes that we are looking at have been derived from the WHO definition of health, which is a state of complete physical, mental, and social well-being. Through this review and past systematic reviews, we have come across a range of health outcomes that generally come out of such interventions, which include violence, maternal and newborn child health, nutrition outcomes. Other outcomes include sexual and reproductive health and general morbidity and particular diseases. The inclusion and exclusion criteria for our studies is, firstly, we're looking at impact evaluations that by design must be a randomized controlled trial or maybe quasi-experimental. They must have taken place in lower and middle income countries as classified by the World Bank. In addition to these main index impact evaluations, we are looking at some the ancillary studies for each of these main impact evaluations. We call them sibling studies. And these sibling studies may be baseline studies, they may be cost effectiveness studies, qualitative studies, process evaluations, or even protocols. With the duration, the time that we are looking at is post year 2000 up until year 2020, so the last 20 years. Our exclusion criteria for screening is that any study that has any of these bullets, as you can see on your screen, will be excluded from our review. Studies that have no control or comparison group, have interventions that are not integrated by nature. They do not have a health outcome measured. Our process evaluations, but are not directly linked to our main impact evaluation, or our studies that do not reliably address selection bias will be excluded from our review. The methodology for our review is, firstly, that this is a mixed methods review wherein we will be looking at quantitative effects as well as qualitative evidence. We have used the platform of Covidence for our screening process, which is a two-stage screening process. We included 7 research databases like PubMed and Scopus, and we have finally come to a study list, which has been finalized in consultation with experts and authors in this field. The extraction process that we are undergoing at the moment for the systematic review has learned from previous systematic reviews that were done. One important part is we are differentiating in terms of extracting the underlying group details on how the group functioned in the control arm and how, when the intervention has been taken upon, how the group functioning changes. And we are also classifying the groups based on the intervention take on, based on the Graham-et-al typology that was developed in 2020. The sibling studies that we are extracting separately but are linked to the main impact evaluation feed into the context, the intensity of the intervention, and the contextual mechanism-related or outcome-related enablers and barriers. Each study that we have included will undergo a quality appraisal based on the study design. For example, RCTs or non-randomized intervention trials. And further data synthesis will be done for both quantitative studies separately, qualitative studies separately on thematic analysis, and finally they will be integrated into a matrix of findings. At the moment, we are at the extraction and quality appraisal stage, but we would want to share with you what we have found so far. Starting with about 11,000 titles and abstracts, we have finalized a list of 38 impact evaluations with accompanying 64 sibling studies. The spread of these studies is localized to about 20 LMICs, majorly in India, 15 studies, and other countries where they have been, these interventions have been found to be implemented are in Kenya, Tanzania, Nepal, Bangladesh, amongst others. We find that a majority of these interventions are implemented and evaluated in rural areas and less often in urban or mixed location settings. The primary or secondary outcomes of these impact evaluations have this range of spread, but most commonly we find that violence is a reported health outcome in these studies. Other outcomes are MNCH, nutrition, which includes breastfeeding, sexual reproductive health, sanitation, communicable and non-communicable diseases, and other diseases in particular. The 38 impact evaluations that we have by design are 22 are randomized controlled trials, while 16 are quasi-experimental. Among the 38 studies, 11 have accompanying process evaluations and only 3 have accompanying costing or cost effectiveness studies. Although our focus has been on the last 20 years, we find publications evenly distributed across the last 15 years. In terms of type of intervention and the type of group that interventions have worked with, we find that half the interventions were implemented in a classroom group setup, which is more of didactic dissemination of information. And about half were implemented in a club or collective setting. A club being an interventions implementation setting where group capacity is enhanced, while collective goes beyond the group capacity and it also includes the community at large in which the interventions are implemented. I will finally conclude with our next steps. First step, of course, would be a synthesis of our findings. And after that, we would like to compare what we find with systematic reviews which were done in a similar setting, but our systematic review is focused primarily on groups and integrated layered health and economic intervention settings. Further, the implications that we hope this review would have is firstly on how studies would be designed for their methodology and their theory of change and how they would be reported. And further, this review could inform on how interventions could be designed and implemented to improve health outcomes in LMIC region. And with that, I would like to conclude my presentation. Thank you, everyone.
Thank you, Roopal. That was, appreciate how quickly you went through that, but I think we took away the main points. I want to thank everyone on the panel and thank you for your resilience, which was demonstrated today vis-a-vis the internet and bandwidth, which is out of our control. I'm assuming that since we're 6 minutes over time, that we don't have an opportunity for questions, but I'm not sure if others know the platform better. Thomas, this is
You can continue. The session will end once you all leave the session.
Oh, so we can continue this session until we leave. Oh,
Yes.
well, that's dangerous. All right. Then I would like to open it up for questions. And I'm assuming that people will put them in the chat. While folks may be thinking about questions, I had one that I wanted to ask, which I just raised briefly. When I looked at the statistics that Eve presented at the outset in Uganda about the age of young girls giving birth and the access to reproductive health, and then I think about your findings, Thomas, on the review of women's groups for adolescents, I don't recall you mentioning reproductive health as one of the outcomes that, information about reproductive health is that. So I'm wondering if maybe you and Eve or Tabitha could comment on those connections.
Eve, Tabitha, do you want to comment on that? I have some thoughts, but maybe you can speak about this specifically from the context in Uganda. Otherwise, I will move ahead and give some thoughts at least. There were some reproductive health outcomes in our review of reviews, and I think some of the interventions specifically focused that specifically focused on economic interventions also had a focus on life skills, which often, when interventions refer to life skills, actually focuses on improving sexual and reproductive health outcomes. I do think this could be an avenue for groups to focus on. At the same time, I also think that there are quite a few evidence gaps when it comes to life skills interventions. It seems that they could potentially improve sexual and reproductive health outcomes, but I don't think we know enough at this point. I feel that there is quite some evidence, but I must also say, like, this is not my main area of expertise. So I also want to exercise some caution in my response, knowing that, like, there might be more evidence out there that I'm not aware of. What I do think, which is important to mention also specifically for adolescent girls groups in the context of Uganda, one thing that was interesting to note is that, like, there were only very few cost effectiveness analysis in Uganda. That said, when it comes to adolescent girls groups, they seem to be among the most cost effective ones. Or they seem to be very cost effective when it comes to improving economic outcomes in Uganda. And it seems that it's worth at least examining the hypothesis whether the same could be achieved for sexual and reproductive health outcomes, though the implementation model of those specific groups would probably be important to assess, like, what specific implementation model. And Eve, I see that you're now on camera, so maybe you want to add to that. I know you know a lot more about this than I do. You're on mute.
Oh dear, this may be the same issue that Rupal had, Eve. She had to, I think, Rupal, did you have to exit and log back on?
Yes, that's what I did.
Well, we're waiting for Eve to unmute. Rupal, did you find anything? I mean, because I know you've looked in this area as well. Is there anything on reproductive health in particular in India that focuses on adolescents? I know your review was not focused on adolescents.
That's right. Again, I would also take Thomas's leaf from his book. I would exercise some caution there, but yes, there have been some studies with adolescents and their reproductive health behaviors, and there has been some gender disparities in that as well, their treatment-seeking behaviors in particular. But yes, I think I would end with that. But adolescent in terms of group setting, I genuinely doubt that. But I would not comment any further. I would really have to look at the evidence out there before I say anything.
Okay. A careful researcher, which is why you're all here. That's great. Thanks. So I have one more question while we're waiting for Eve as well, which is, Becca, in your presentation, you noted that there was some evidence that that women's groups may not equitably support member resilience. And as well, just in general, obviously, when one creates a group, one creates people outside the group. So I'm wondering, across your review, and anyone can speak to this, how much evidence there is on unintended consequences of groups. Is that something that we need to worry about, or is that something that we feel like the evidence on the benefits is so scarce that we haven't even begun to look at the potential unintended negative consequences? Becca, I don't know if you want to respond first, and then if others have ideas.
Sure, I can start. It's not letting me show my video, but at least my mic works. Yeah, I definitely think it's underexplored. The studies, I don't think that we found any like quantitative subgroup analyses with sample sizes enough to draw like sort of like causal inference conclusions from, but we did find qualitative evidence of some members getting kicked out of groups after shocks when they were maybe poorer or less able to contribute. And I do think it's an underexplored area. And I also think that it's an interesting research question to look for unintended consequences. And I haven't seen much of that. But I do think it's an avenue for exploration.
Thank you. Anyone else have any comments on that, or should I ask my final question? Not seeing any mics unmute. So my final question is thinking about risks, and again, particularly raised in your presentation, Becca, but when we think about the purpose of a group as mitigating some of these risks, and particularly covariant risks it's a struggle, because with a covariant risk, everyone within a certain spatial area is going to be subject to the same hazard. And so I'm wondering, and I'm really hoping that Tabitha and Eve can weigh in here as well. Across the, Uganda and my limited understanding is that India has a much more national network that individuals can tie into, which seems that it would help mitigate some of these local risks that still affect individuals in a particular village, for example. Is that the case? Are they finding that the national networks in India are well positioned to smooth out these risks across geographies? And is that something that is being examined in Uganda?
I'll just say from our studies, India's self-help group network those made up the most studies sort of founding our finding about the formal linkages to groups mitigating risk. And I'm super interested if Eve or Tabitha have any information on if groups are networking more or forming linkages outside of villages in Uganda or other areas.
From Uganda, I would say the evidence is inconsistent, but definitely there is evidence for an increased intensity in networking opportunities. And I just wanted to touch base on the adolescents and reproductive health, and to note that the biggest programs on women's groups that we have on adolescents and reproductive health are the DREAMS program, and then we also have the No Means No program. And I was part of the group that evaluated the DREAMS program, and we found weak evidence of impact on delayed pregnancies, but the uptake for contraceptives or even access to contraceptives was not very convincing. That's what I can say about that program. And the No Means one is still novel and new. We are yet to see its impact on access to contraceptives for adolescent girls.
Well, that's disappointing, but interesting. Do you have any hypotheses as to why you're not seeing much impact?
I think the biggest problem is economic vulnerability of these girls, actually. Even if all this is done and all these vulnerabilities are not addressed, still they will be lured into dating. And then there is also the issue of pressure if you have a boyfriend, and then there are also issues of social norms. The boyfriend might be pushing for a child, else they will cut off the economic supply, and then also the pressure from the social norms side. So the girls will be pushed to give way, and they cannot delay the pregnancy, or they may not even be able to use the contraceptives. So it needs a multidisciplinary approach and a health system approach to confront this giant.
Oh, thank you. Well, thanks again, everyone. If there are no further questions, if anyone has questions they want to ask of other participants, Rupal, do you have a question, or you're just on video to say, well, thank you all
Just
so
came
much.
back on.
Okay, well, I certainly enjoyed that. I appreciate the work, and I'm assuming that everyone will have access to the PowerPoints. Is that correct, Thomas? Do you know? Okay.
Yes, we will also certainly share those as soon as the video is available with the Evidence Consortium on Women's Groups. I'm just putting in the chat also for everybody like who's not familiar with our website, like just our website as well. And we will try to make sure that videos will also be posted there in due time, and
Right.
as well as the
Thank you.
PowerPoints.
All right. Well, good night to everyone. Good day to Becca. And we'll see you all again.
Thank you all.
Thank you.